everybody. Thank you so much for joining APDA for the launch of our exciting new series, Thriving Through Speech Therapy. I am so grateful to have Ali Reed and Alexandria Russell here to present on a really, really important topic, and that's understanding speech, swallowing, and voice changes in Parkinson's. Ali Reed is a speech language pathologist located in Chicago, Illinois. She specializes in neurological communication and swallowing conditions and has practiced in acute care, outpatient, inpatient rehab, and in community support groups. Ali is currently pursuing her PhD in health science at Nova Southeastern University, where she researches the impact of communication disorders on spouses and couples. She is passionate about functional communication practices, communication access, and caregiver support. And Alexandria Russell is a speech language pathologist and a caregiver to her dad with Parkinson's. She creates resources, webinars, and support groups for Lingraphica, a company that helps people with speech and language impairments improve their communication, speech, and quality of life. Welcome, Alex and Ali.
Thank you so much, Anushka and APDA, for having us. Ali and I are really excited to be here. And we both have personal connections to Parkinson's. So we're thrilled to share our professional and personal knowledge with you all today. So let's talk about understanding speech, swallowing, and voice changes in Parkinson's. Anushka gave us a wonderful introduction. So you'll be hearing from both me and Ali today. I'm Alex,
And I'm Allie.
and let's get ready.
All right, so just a quick financial disclosure. Both Alex and I are employees of Lingraphica and thereby receive a salary from the company.
And here are the learning objectives for today. So Allie and I will be chatting with you all for about 30-40 minutes. And by the end of our time together, this is what you can expect to learn. You all will be able to identify common speech, voice, and swallowing changes in Parkinson's and how these changes really impact your day-to-day communication, safety, and social participation. You'll also be able to describe how Parkinson's affects the muscles and systems that are involved in speech production and how loud your voice is and your swallowing skills. And lastly, but certainly very important, is explaining the role of the speech language pathologist, or SLP, in evaluating, treating, and supporting individuals with Parkinson's, as well as going over some evidence-based strategies and therapy options.
All right, and we have a lot on the agenda today. So we just went through our welcome and our introduction. Next up, we're going to be talking about those speech, voice, and communication changes that happen in Parkinson's disease. Then Alex will cap us off with some swallowing changes in Parkinson's disease. I'll talk about the impact that all of this has on daily life and social confidence. And then Alex will wrap us up with how SLPs can help evaluation and treatment. And then we'll finish with some key takeaways and our Q&A, of course. All right, so let's go ahead and dive into those common communication and swallowing challenges in Parkinson's disease. First, I want to give an overview of what Parkinson's is, especially for those of you who are maybe new to this diagnosis or are here for a family or a friend. So Parkinson's is a progressive neurological disorder, and this means that the symptoms are going to develop and worsen over time. We're going to talk about stages of Parkinson's in just a moment here, but the big takeaway about Parkinson's is that symptoms can really widely vary from person to person. There is a joke in the Parkinson's world that if you've met one person with Parkinson's, you've met one person with Parkinson's. Everyone is so very different. But typically the symptoms that someone with Parkinson's will experience can fall into two categories. So we have the motor symptoms, which affects movement. And I think this is what most people think of when they think of Parkinson's. The tremors, the shuffled gait, the slow movements. That's all motor symptoms. But then we also have non-motor symptoms. So these are things that are not talked about as much, but certainly co-occur with Parkinson's. So these are symptoms that can affect your thinking, your memory, your mood, and some other body functions that we'll get into as well. So let's dive into those stages. So stage one is mild symptoms. This is probably when you just start noticing that things are maybe a little bit different or that something isn't the same as it was before. You're most likely able to still participate in your activities of daily living. You are maybe living independently, driving, working, walking, no problems with any of those activities of daily living. You might start to notice tremors on one side of the body, and that usually starts in a finger or a toe. But you might also start to notice some masked facial expressions, and we're going to talk more about that in a bit. But that's really the lack of facial expressions or kind of a stone expressive face. Next up is moderate symptoms. So the symptoms that we talked about prior are progressing. That tremor is now migrating over to the other side of the body, and we're introducing rigidity in this second stage. So that tightness or stiffness. These activities of daily living are becoming a little bit more challenging, but still able to function independently. Now, the third stage is really characterized by loss of balance and falls. This is when those tremors are worsening, the falls are happening because of the rigidity, and you're starting to require some assistance, maybe with bathing or walking or toileting, etc. Stage four is considered advanced stage, and this is when symptoms become pretty disabling. So patients probably need a walker or a wheelchair to move about. They're likely not able to live alone at this stage and require pretty significant assistance with those activities of daily living. And then lastly is late stage. This is when there's extreme stiffness and rigidity. Many patients are bedbound at this stage. Many have swallowing difficulties, cognitive difficulties at this late stage. And then the asterisk that we put at the bottom here is that communication and swallowing changes can occur at any one of these stages. So for some people, it's the very first thing that they notice of, wow, I'm feeling like I'm quieter, or maybe people can't hear me as much, or I'm noticing that masked facial expression. And then for others, they don't notice it until stage four. So again, everyone is very different. So let's dive into what those communication impairments are. First, I want to note that according to research, anywhere between 75 and 90% of people with Parkinson's will experience changes in their speech and voice. So even though we don't know what stage it's going to occur in, it is pretty likely that every person with Parkinson's will experience some change to their communication at some point during the disease progression. So some things that can happen here, vocal cord bowing. What I mean by that is your vocal cords come together and vibrate in your throat. When you have Parkinson's, they start to bow, so they can't fully come together, and that creates a raspy or breathy voice. That leads us into the softening of the voice. Maybe you've noticed that you or your loved one are just talking a lot quieter or are more difficult to understand. You may experience a vocal tremor. So muscles are affected everywhere in the body, including in the voice, and you might have a little bit of shakiness in the voice. Difficulty with speech initiation. So getting that word out or starting a conversation can be challenging. Stuttering is not uncommon. So maybe repeating sounds or words. The next one here we have is called hypokinetic dysarthria. This means a very small mouth movement. So as we are having that masked facial expression, all of our movements are getting much, much smaller. And that includes in the lips and the mouth. Some patients may have rapid, unintelligible speech where they have almost like a burst of really fast speech all at once, or reduced breath support. So you may notice as you get to the end of the sentence, you're running out of breath. That's that reduced breath support. So looking at language and cognition, the previous slide was more about speech and voice, but some patients with Parkinson's will have language or cognitive impairments as well. So as far as language, people with Parkinson's might have difficulty understanding what's being said to them. So that's auditory comprehension deficits, difficulty with creating a grammatically correct sentence, difficulty naming things or coming up with things in a category. If I say, hey, give me a list of dogs, that would be challenging, perhaps, for someone with Parkinson's. And then also difficulty producing action words. So we know that this is a movement disorder. The words about movement can also be hard to get out. And then lastly, some patients will experience cognitive changes. So this is difficulty with problem-solving skills, those executive functioning, judgment, planning, decision-making skills, some challenges with memory, and then also attention, being able to attend to something for a period of time. And then lastly, there's some things that are just other communication impairments. The first being sensory changes. We have this impaired auditory biofeedback. What does that mean? Well, that means that in addition to a person's speech getting quieter, their brains are also no longer able to hear how loud they are being. So someone with Parkinson's might be speaking like this and think that they are speaking at a normal volume. So it's really not useful to say, speak up, you're being too quiet, I can't hear you, because they are not able to tell how loud or quiet they're being. We already talked about masked facial expressions. And then another change that can happen is micrographia, or very, very small handwriting. All right, I'm going to pass it over to Alex, who's going to talk about our changes in swallowing.
Yeah, so thank you, Ali, for that great overview of communication impairments in Parkinson's. And now we're going to talk a little bit about the swallowing changes that can occur. So why do swallowing changes actually happen? And if we look at research, it tells us that around 30% to a little bit more than 80% of people with Parkinson's will develop dysphagia. And if you haven't heard of that term before, dysphagia is the medical term for difficulty swallowing. Okay, so again, dysphagia, medical term or diagnosis for difficulty swallowing. And so, why do these changes happen? We already know Parkinson's can slow down movement, it can weaken muscles, but it can also have that same effect to the muscles that we use not only for chewing, but the muscles that we use for swallowing as well. Ali talked about some facial movements and writing, things getting smaller and smaller, right? And so the same thing can happen with the swallowing muscles. Those movements may become smaller and smaller, as well as a little bit less coordinated. And so what happens? It may take longer to actually start your swallow. It may take longer for you to chew, to move food from the front of your mouth to the back of your mouth. And this can make eating feel tiring for some people. It can make eating feel really effortful, and it can even impact the safety of eating. So, what are some of the signs of dysphagia or signs of difficulty swallowing in Parkinson's? And when we talk about swallowing, there are really three phases. And I'm going to go over those phases as it relates to these symptoms or signs that you see on the screen. So, first is our oral phase of swallowing, and that deals with everything related to your mouth. So, think your lips, your cheeks, your tongue, your teeth, everything in the mouth. And so, some signs that you might have difficulty with your oral phase of swallowing: drooling, trouble managing your saliva, or even longer meal times, getting tired while eating, or again, feeling like eating is really effortful. Then we get to the second phase of swallowing. That's called the pharyngeal phase. And that comes from the word pharynx, which is another fancy medical term, which basically means your throat. All right, so again, our first phase was oral, that's the mouth. And then the second phase is pharynx or the throat, that pharyngeal phase. And so, what are some signs that you might have difficulty with the pharyngeal phase of your swallowing? You might feel like food is sticking in your throat when you swallow, so not quite going down, right? You might have a wet or gurgly sounding voice after swallowing. One of my patients, he would always refer to this as I'm underwater. And I think that's a great way to relate to this sign is your voice might sound like you're actually speaking underwater. Food or liquid may go down the wrong pipe. I think we've all had that happen before, right? It just doesn't feel good. And what can that lead to when food goes down the wrong pipe? You are coughing, you are clearing your throat, and that can happen during a meal or maybe even a little bit after your meal. And then another sign in that pharyngeal phase is aspiration or aspiration pneumonia. What is aspiration? That is when your food, liquid, or saliva accidentally goes into your airway and the lungs instead of your esophagus and your stomach, right? So we have an air tube and we've got a food tube. We do not want food or liquid or anything else hanging out in that air tube because that leads to the lungs. That's when it goes down the wrong pipe. Okay. And then if that happens enough, that could potentially lead to aspiration pneumonia, which is a serious lung infection that comes from inhaling food, liquids, and saliva into the lungs. Okay. And this causes inflammation, it causes infection. And what happens? You're swallowing those protective mechanisms. Something went wrong there that allowed all that food and liquid to get into your airway and into your lungs. All right, so this requires typically medical attention when you have aspiration pneumonia, okay, and also a speech therapist to help. Please see a speech therapist. And the last phase of swallowing is the esophageal phase. Now, this is mostly managed by a GI doctor or a gastroenterologist, but a speech language pathologist can still give you recommendation strategies and tips. So, what might you see if you're having esophageal dysphagia or some difficulty with that phase? You might have unintended weight loss, right? You're eating, but you are just not gaining any weight. In fact, you might be losing weight. You might find yourself avoiding certain foods, or you may even suffer from heartburn or acid reflux. And so, with all of that being said, all of those signs of swallowing changes, I also want you to know that swallowing is very dependent on your medications, right? We have off times and on times. And so if you're in an off time, your swallowing might be a little bit worse than when you're on your on time. So just something to consider when you're thinking about your own swallowing. Think about the medication timing as well as it relates to meals. And then we're going to finish up swallowing here with talking about just a few important reminders. Do not wait for a problem to happen. Allie and I don't want to hear you ended up in the hospital with aspiration pneumonia because you did not see a speech therapist. All right. So the thing with Parkinson's we talked about is progressive. So it is okay to establish a swallowing baseline now. Know what your swallowing skills are in this current stage of your Parkinson's journey. Get a swallowing evaluation. Okay, this is going to check the safety of your muscles, identify the cause of any potential difficulty, and you can also create a plan to make eating easier and safer. Keep a journal, a tracker of the signs and symptoms that you're experiencing. Your speech therapist will love to see it, as well as your doctor, okay? And then please know if you are experiencing any of these difficulties, there are things you can do to help. This isn't like, oh my gosh, I'm having trouble swallowing, I'm never going to eat again. No, 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 okay? There are compensatory strategies that can be used, and we're going to talk about some of these. There are rehabilitative techniques that can help. There are adaptive utensils, weighted utensils, cups and plates that suction to the table in case your tremors are making it move around, okay, to help with those motor difficulties. So know that there is something that can be done to help with swallowing. All right, so Allie's going to take it away and talk about the impact on all of this on daily life and social confidence.
Yeah, thanks, Alex. You know, I really am glad that we have this section in this presentation because I think that when we think about speech and voice and swallowing, we just think, oh, yeah, that's just something that will happen, but it's much bigger than that. It ripples out. This really can impact your daily communication, your social circle, your confidence, your self-esteem. So I want to talk about if you're starting to experience some of these things, they are real and valid and true, and what can we do about them? So first, let's talk about the social impacts of Parkinson's disease. Unfortunately, we know at least 40% of people with Parkinson's will develop clinical depression or an anxiety disorder at some point during the disease progression. And of course, mental health is still very stigmatized. So 40% is probably an underestimate. I bet it's much higher than that. Communication disorders that come along with Parkinson's, like slurred speech or that masked facial expressions, often contribute a lot to insecurity. If you're not able to communicate the way that you did before or connect with people the way that you did before, you might withdraw and become more socially isolated. Now, all those caregivers in the room, we're talking with you as well. You might also experience depression and loneliness because of the care demands. This condition really makes you have to stay at home a lot. And that's because of the movement disorder and the difficulty getting out of the house. With all of that, it may make you feel more socially isolated. And those care demands can really rack up and take over the whole day, which can really impact social interactions as well. So, like I said earlier, depression and anxiety, these are two of the most common non-motor symptoms for people with Parkinson's disease. So, what does the research say? The research says that these symptoms and this stigma around the symptoms can lead to social withdrawal. So, that can cause you to feel socially isolated. And of course, we are social creatures, and being in a community and having a connection with people is really what helps us to stay healthy, mentally and physically, especially in older adults. So, at least half of people with Parkinson's report avoiding going out in public because they're not as comfortable anymore, or they feel more insecure about how they're presenting to the world. Like I said, care partners are all also included in this. They may experience social isolation because their loved one can't communicate the same way anymore. Maybe you have couples friends, and now it's challenging to meet up with them because you're having that communication breakdown. But it is highly recommended that you look into community-based social activities, support groups, conversation groups, activity groups with other people who are on the same journey and understand the changes that you're going through. So definitely look into your area or virtual options to find that social support for this journey. And then just to really bring this home, to talk about the benefits of social interaction, it's been found that support groups can provide a social connection that cannot be replaced by family or friends or healthcare professionals. So I, as a speech pathologist, can tell you all day long how important it is to get together and meet up with other people on the Parkinson's journey. But really, that comes better from someone who also has Parkinson's. That shared experience just really takes it to the next level, something that friends and family can't provide. Um, Online groups. I always say this is probably the best thing that came out of COVID is there are so many virtual options now. So if you do have trouble getting out of your house, if you live somewhere that's really cold or really hot, or maybe you just have difficulty with transportation, there are so many online groups, many of which are free, that you can join and connect with other people who are on this journey. Care partners, you too. There are lots of virtual groups and in-person groups for you as well. So that social engagement, maintaining relationship, that's really going to contribute to your life satisfaction, your physical, emotional, mental health, and your overall quality of life. So please find a community. You've already found the APDA, which is half the battle. So look into everything they have to offer. And Graphica has options as well, and find your community for this journey.
Yeah, thank you so much for sharing, Allie. And Before we dive into how SLPs can actually help with all of this, I just wanted to share a personal story as both a caregiver, former caregiver, and daughter of a dad with Parkinson's. Every time I wanted to get my dad to leave the house, it was like pulling teeth. And he never wanted to go, especially in his later stages, because we had to take the wheelchair and we had to take the supplies for the colostomy bag and we had to bring gloves. And like, I did not mind. I schlepped all that stuff in the back of my SUV and I was like, we're going out. For those of you on here with Parkinson's and also for caregivers, you might have to push a little bit. And for those of you with Parkinson's here, you might have to go out of your comfort zone a little bit, and every time my dad did not want to go, we ended up having a really great time and he was asleep in the car on the way home. So sometimes we do need a little bit of pushing from our loved ones. And then related to support groups, I waited years too late, I will be very honest, to go to my own caregiver support group, thinking as an SLP, someone who's been doing this for 13 years. I didn't need a support group. I can just chat with my husband. But as Ali said, there's really no replacement quite like a support group. It cannot be your spouse or your partner. And being able to go to a support group of adult children, I'm a millennial, 37, and not many of my parents had, not many of my friends, excuse me, had older parents with a disease like this. So to be able to be in that space with all people around my age who had a dad or a mom with Parkinson's, like wow, it was such a weight lifted and I felt so comfortable and welcome talking about these things. So please join a support group, whether you are a caregiver or someone with Parkinson's. It really is life-changing and just such great support. Okay, so now let's talk about speech language pathologists, SLP, speech therapists, all interchangeable. We're going to talk about how we can actually help from evaluation and treatment. We're going to talk about communication, cognition, and swallowing. Okay, so what does the SLP actually evaluate? All right, so this is going to happen through a series of formal assessments. Your therapist might say, hey, I have to give you a standardized test or I have to give you a formal assessment. Insurance loves this. Okay, this is what helps with reimbursement. All right, so we do have to give some sort of formal assessment, something standardized, but there are informal assessments, which Ali and I love, and I hope that your therapist is using with you, excuse me, and these are called patient-reported outcome measures, which are almost like questionnaires or checklists, which takes into account you as the patient or you as the caregiver and how you feel, how you're actually doing. Sometimes those standardized assessments don't take into account our feelings and like the real nitty-gritty day-to-day stuff. So having a combination of something formal and standardized with a patient report or caregiver report makes for a really successful evaluation. Okay, so talking about speech, language, voice, cognition, swallowing, let's look at what an SLP might be looking at during your evaluation. They're going to assess your loudness of your voice as well as your breath support. So they might have you say, all right, take a deep breath and go, ah, right? And then they're going to assess how long you can hold that or hear the quality. They might also assess the clarity of your speech, also known as articulation or intelligibility. So they might have you read some words, read a paragraph, read some stories, or even tell a story. And that's going to give them an idea of your articulation, as well as the rate and the rhythm of your speech. I always tell my patients, I'm going to have you make a few funny faces at me. And why are we doing this, right? We're going to take a look at your facial expression, your movement. Okay, this is also really good to check the range of motion and the strength of all of those facial muscles that are not only used for speaking and voice production, but are also used for chewing and swallowing. Okay, so that SLP is going to look at not only the motor component, but also the sensory, right? So are you able to feel things the same in your mouth or taste things the same in your mouth? That's sensory. Motor would be actually moving your jaw, right? Chewing, moving your tongue. And then all together, this evaluation is going to capture your strengths, what you are really good at, what's going well, and also capture some weaknesses, things that need to be improved, and how these impact your activities of daily living, ADLs, you've probably heard of that, your daily communication needs, as well as your meals. And really, this evaluation is what is going to guide your treatment. So, we're going to talk about voice and speech treatments next. Okay, so when we talk about therapy today, please know that therapy can be rehabilitative, meaning we're trying to rehabilitate or fix the issue, or it can be compensatory, meaning we may not get 100% function back, but we can compensate for some things that aren't going to be functioning at their best. So, some voice and speech treatments. You might work on some breathing and voice exercises to really strengthen how loud your voice is, right? And speech therapy can focus on, like I said, the breathing, voice strengthening, articulation, even pacing to improve volume, clarity, as well as your confidence in communication. And by participating in speech therapy, people with Parkinson's, you can preserve and maintain your ability to speak clearly for longer and reduce frustration. Big thing, reduce the what, say it again, right? Next, I want to touch on the LSVT loud and speak out treatments. I don't know if anyone here has taken these treatments before, but these are special therapy programs designed to improve the loudness and intelligibility of someone's speech. These are evidence-based treatments. They require an SLP to be certified in the program, and therapy follows a strict protocol. So there is a regimen that you have to follow. Both of these treatments are highly effective, but please know they are not a cure. Okay, so people may still need to repeat this program as you get later on in your Parkinson stages. You might also work on AAC with your SLP. This stands for Augmentative and Alternative Communication. And what is that? That refers to tools, strategies, or supports that's going to help someone with a speech or language impairment to communicate better. So that can look like pen and paper. That can look like a communication board. That can look like a communication device. If you have texted something instead of saying it, you have used AAC. If you have written it down, if you've gestured, thumbs up, thumbs down, you have used a form of AAC. All right. So let's talk about cognition and language treatments. Ali touched on in the beginning some of those changes in memory, some of those changes in attention, maybe even some changes in sequencing, organization, even word finding. So, what can be done to actually improve this? Your therapist might work on some strategies to improve those cognitive issues. They'll work on word finding support, practicing conversation and the skills you need to be successful with your language. You might work on some exercises to strengthen your problem solving and daily planning. So let's say you're having a really hard time making your coffee in the morning, you're forgetting steps, things like that. Your speech therapist can actually work on the steps that you need and the language to make coffee, right? Your therapist will also work on techniques to reduce any potential overwhelm, your processing speed, also introducing external tools to help with memory. So please know this is not cheating. So many of my patients say, well, I feel like I'm cheating if I'm using this. This is the time to cheat, okay? The goal is to remember. So if you need to cheat, this is the time, right? So that might look like calendars, phone reminders, checklists, visual cues, signs that maybe you have on the mirror or the front door, cell phone, wallet, keys. Okay, right? They're not cheating. These are to help your cognition. And even additional support you might need for understanding complex information, as well as communication partner training. It's so, so important. Working with the people in your life that you talk to, whether it's a neighbor, a spouse, a friend, that communication partner should receive some training to make conversation smoother. All right, lastly, we're going to talk about swallowing treatments before we get to some key takeaways, some resources, and then Ali and I are going to answer some questions for you all. So let's talk about swallowing. What are the treatments here? You can go through kind of two routes here with dysphagia, right? That medical term for difficulty swallowing. You might follow some traditional swallowing exercises. So just some strength and coordination exercises. Again, your therapist might tell you to make some funny faces. You might have to do a series of certain swallows to help improve range of motion and strength. There are also non-invasive electrical stimulation treatment methods, and the two of those are called amp care and vital stim. Very important that the SLP you're seeing must be certified for you to receive these treatments. Now, these look like a little stickies that are placed on your swallowing muscles. And when it's turned on, it's a little electrical stimulation. So it feels like little ants crawling up and down. But depending on where you have weakness in your swallowing muscles and depending on where these electrodes are placed, it helps to stimulate and to strengthen those areas. So again, it's a great treatment method. You just have to find someone certified in this. You might hear about posture techniques. So maybe tilting your head, tucking your chin. Please know a chin tuck is not for everyone. So please see a speech therapist and make sure you know what strategies work for you. You might learn about some feeding strategies. Alternate a bite to eat, a sip to drink, sit upright for 30 minutes, right? Chew before you swallow. Swallow twice, then clear your throat. Those are all strategies. You might have your food or drink modified when needed for safety. That might look like thickening liquids, that might look like chopping up your foods, having softer foods, avoiding dry, hard, crunchy textures. Again, talk to your speech therapist about this. Your therapist might also work on some tips to work on that drooling and some better saliva management, as well as pacing out your meals to help reduce fatigue. So those are swallowing treatments. And please know that this series of webinars that Ali and I are talking about, there's going to be two more throughout the earlier part of this year that are going to dive deeper into these. So you all will learn more about swallowing treatments. You're going to learn more about cognition, more about communication and language. So we're going to end with some key takeaways, some things that we do not want you to forget. We've thrown a lot at you in these 30 minutes, but some really important things. Remember, speech, voice, and swallowing changes are common in Parkinson's, okay? And there are ways to help. Small changes in breath support, in loudness, and pacing can make your communication clearer and more confident. Swallowing changes should never be ignored, okay? Early evaluation helps to keep eating safer and more enjoyable. Speech therapy can improve your communication, your safety, and quality of life at any stage of Parkinson's. You do not have to wait till stage 5 or severe or till you can't talk at all. Okay, see us now. We'll be happy to see you, we promise. And know that you don't have to manage these changes alone. SLPs are here to help. We've got tools, we've got strategies, and we have supports for you. So we have two resources that we'd love to share before some questions. And Ali, do you want to share with everyone what these resources are?
Absolutely. So this first one here is called a Parkinson's Toolkit. You can scan the QR code. The link is at the bottom of the slide, or we're also going to put the link in the chat for you. So this toolkit has a lot of different resources in it, including, I think my favorite resource in it is a Parkinson's ebook that our very own Alex Russell created. Y'all, this ebook is amazing. It is everything we covered today and more about speech, language, cognition, swallowing. It's beautiful. Please download our toolkit. It's all 100% free. All the resources in it are free. So please take a look at that, scan the QR code, or click the link in the chat. And then the other resource that I want to share is a fantastic resource by the APDA. And this is a communication ID card. So this is something that you can keep in your wallet, your purse at all times. And it lets you advocate for yourself about Parkinson's disease, the communication challenges that you may be experiencing, and hopefully it can help you just to be able to share with whoever you're communicating with about what you need and why maybe your communication is challenging for you in that moment. It's a really great tool to have, a really great resource to just have in your back pocket, a nice little safety net. So again, scan the QR code, the link is at the bottom, or you can find a link in the chat as well. All right, everyone. So that's Alex and my spiel. I know we have 100,000 amazing questions in the chat. which I'm so excited to dive into. So let's see, should we just take it from the top?
Yeah, let's just take it from the top. Our first question came from Dia Long. She commented that she runs out of breath all the time when she talks, and she said, I didn't know it was related to Parkinson's. Are there any treatments or medications that can help?
Yeah. Hi, Dia. Thank you for the question. And so if you're running out of breath while you're talking, you might want to chat with your SLP about working on pacing techniques to help with that. You might also want to have them assess your breath support. And there are two tools that I can think off the top of my head, and Allie, you can correct me if I'm wrong, that help with breath support. One is called the breather, and the other one is called the EMST. And both of those are two devices to help with breath support. Again, it's not a cure, but it is a treatment that you can use within therapy to help with that running out of breath that you're experiencing while speaking.
Thank you. And our next question is from Neil. Neil asked, can DBS impact swallowing or speaking for better or worse?
Great question. Yeah, Neil. So typically DBS can impact swallowing or speaking for better. That is usually a positive thing. What I will say about DBS is, again, as Parkinson's progresses, the DBS will need to be turned up and up and up. And then there might also come a day where you need to supplement with medication on top of the DBS. So that carbidopa, levodopa, or the traditional medications for Parkinson's symptoms. So yes, definitely, it can help with managing the swallowing and speaking challenges that you're experiencing, but it's not a cure. It's going to continue to progress over time and will need to be managed over time.
And we have a question from Janet. And Janet has shared that sometimes her jaw snaps shut when she's eating and she bites her tongue. And she's asked if you have any suggestions for avoiding this.
Thank you for the question, Janet. This is a tough one, I think, to answer without me and Allie being able to get inside your mouth and look at your jaw. So, what I would definitely recommend is getting a speech therapy evaluation to assess that jaw. And they can even recommend if they think like seeing a dentist might be necessary. But it's hard to give you like an immediate answer to why your jaw might be snapping shut. But if it's something that's impacting your chewing, your swallowing, your eating, or even your communication, you definitely want to see a speech therapist about it.
Thank you. And our next question is from JM. And JM asked, when should I start LSVT loud? If I don't yet have those symptoms, it would be hard to measure success in the exercises. So should I wait until I see symptoms?
Excellent question. Should you wait to start LSVT loud or speak out? Potentially, your speech therapist might not recommend it yet. Should you wait to see a speech therapist? No way. I always joke with those who have progressive conditions like Parkinson's disease, the best time to see a speech therapist or an occupational therapist or a physical therapist is yesterday. Get in there, get that baseline established so that 6 months, 6 years, 60 years from now, if you are starting to have those communication or movement challenges, you have something to compare it to, and your speech therapist will be able to tell you when to pull the trigger on that LSVT loud.
Thank you. And we have another question actually about speak out. And the question from Barbara is, once you have completed the speak out or LSVT loud therapies, are you supposed to continue doing the exercises on a daily basis?
Yeah, so with LSVT Loud and Speak Out, they each have their own separate therapy routine that you practice. So I'm Speak Out certified, and the sessions are twice a week for 30 minutes. And then there is a twice a day home practice that is also supposed to happen on top of that. So both LSVT Loud and Speak Out are different in the kind of therapy routines and home practice. But one of the most important thing with Parkinson's, no matter if you are doing Speak Out or LSVT, is consistent home practice. It's not enough to just do it once a week. and think that that's going to make a difference. I'm sorry to say, but we have to practice just a little bit more if the goal is to maintain gains. So you might see some quick gains. You're going to therapy, awesome. But once you stop practicing, you might see those gains go away. So consistent practice is key.
Thank you. I have a couple of questions that have just come in from Richard, also about DBS. Richard asked, does e-stim work with a patient with DBS?
So vital stim, I believe, is contraindicated, excuse me, with DBS. I would always check with the manufacturer of the company that you got your DBS from, your neurologist, your movement disorder specialist, before you do any new treatments, but especially if you're working with any sort of electrical stimulation and you are a DBS patient. Thank you for bringing that up, Richard.
And Richard has also asked if you can share the QR codes at the end again. So maybe if we could go back to a couple of those QR codes, that would be great. Thank you. And in the meantime, we have a question from Ron. So Ron's husband suffers from hypersalivation, and he also had dysphagia, and he's had half of his tongue removed due to tongue cancer, and they're trying to eat pureed foods for dinner. And they're looking for some guidance on where to get meat because meat can be hard to swallow due to its gritty texture. Do you have any recommendations around nutrition resources for people with dysphagia?
I would definitely recommend seeing a nutritionist or a dietitian because these are questions that Allie and I get all the time from people with dysphagia. And it's a wonderful question because if the way you can eat is now different, right, the type of nutrition you can get into your body is also changed. So unfortunately, SLPs do not have degrees in nutrition or dietary needs or anything like that. So please check with your insurance, see what's covered, and see a dietitian or a nutritionist to help.
And
Thank you.
one more thing to add to that as well is if he is feeling like some of the pureed foods are really gritty, what I used to tell my patients is the wetter, the better. So
Mhm.
anything that is really soft and moist and covered in a lot of sauces and gravies, that really slides down a lot easier. You think of your throat like a water slide. You want to have it real nice and slippery in there. So if he is experiencing that gritty flavor or gritty texture, maybe a gravy or some sort of like thickened sauce could be helpful just to help with the texture and making it go down a little bit easier.
Thank you, Allie. And I have a question that's come in from Paula, and Paula's asked, how can I help my dad with drooling?
Yeah, so again, Allie and I, we're going to sound like a broken record. See a speech therapist because they're going to be the ones who really can assess dad's mouth and get in there and really let you know what's going on. Is the weakness on the left side, the right side? Is there too much pulling in the front, in the back? So they can really give you a much clearer response than Allie and I. But some basic things that work are swallowing more frequently and being intentional about swallowing, thinking about it, and working on the practicing of swallowing more frequently. Also, sometimes having a mirror up, little pocket mirror, if you're, sitting at the dinner table or sitting on your bedside to actually see what's going on, because sometimes you may not feel it or know that you're drooling. Um, but again, I would definitely recommend seeing a speech therapist because they can give you some exercises that can help tighten up this area and hopefully prevent some of that drooling. I don't know if Allie, you want to add anything to that.
No, totally agree.
Great, thank you. And I have a question from Carol, and she asked if you could discuss choking. And specifically, she said that there are devices that are currently being advertised or sold on Amazon that can help with choking. Would getting one of those devices be recommended?
Yeah, that's a great question. I have seen those devices. I cannot speak to the evidence to support those devices just solely because I have, that's not the space that I live in is those types of devices. What I can say is that again, here we are, go to a speech therapist. But I would recommend going to a therapist so that you can talk about consistencies, strategies, positioning, and safe swallow strategies if choking is a concern. And of course, it is a huge concern. But as far as those devices to kind of expel a lodged piece of food or what have you, I really can't speak to the efficacy of those. But I'm sure on their website they have evidence to support what their devices are. I just don't. I'm not familiar with it.
Along the lines of choking, just please make sure everyone is CPR certified as well.
Yes, that as well. Yep.
Great, thank you. And I have a question from Geraldine. She's asked, are there any websites that you recommend for vocal cord strengthening exercises?
Great question. So as far as websites, maybe Alex can think of some. I can't think of any off the top of my head, but what I would recommend vocal cord strengthening is really what we do with LSVT Loud and Speak Out Therapy, which each have their own practice websites. So I'd recommend going through those protocols and keeping up on those exercises because that's really where you're going to get the most evidence-based treatment for that, for what you're looking for.
I will also share the link, the Parkinson Voice Project, which is a nonprofit that provides free speak out speech therapy sessions around the country. They offer free online home practice sessions every Monday through Friday. They do them live. I'm gonna pop them in the chat here, Anushka, for you if we can get that and Rosa get that to everyone else. But it's free and you can join and sing along or practice their speech exercises. But again, like Ali said, we're gonna recommend speech therapy.
So, speaking of speech exercises and vocal cord exercises, we've had a few questions from people asking if singing helps with voice changes.
Yeah, singing can be a great way to maintain your vocal cord strength and to work on those pitch glides. In fact, I had a patient who preferred to sing than to do the actual exercises that we were working on, but he was still working on sustained phonation, that and his pitch glides as well. So, I think singing can be a great way to, again, continue to maintain those gains. Again, not a cure. It's not going to fix your voice, but can be a great thing to still participate in.
Thank you. And I have a question that's just come in from Mike, where, we've talked a lot about drooling today, but Mike has said that he has insufficient saliva and that dry mouth actually blocks his swallowing. And when he has that dry mouth and he can't swallow, it makes him feel jerky or almost panicky. And he's asked if this is common and do you have any ideas?
Yeah, great question, Mike. So first thing I'd recommend is I'm actually not going to recommend speech therapist this time. I'm going to recommend to go to your doctor and talk about medications because dry mouth is a very common side effect of medications. So talk with them maybe about if you're experiencing this, maybe there's a modification that they can make in the type or the amount of medication that you're taking. The second thing I'll recommend is there are actually synthetic salivas out there. There are mouthwashes, mouth sprays, or lozenges that you can get just at CVS or Walgreens so that it helps to produce more. It's not real saliva because it wasn't produced by your salivary glands, but it's this synthetic saliva so that your mouth is more moist and you can have more of a comfortable swallowing experience. So those are available just at your local drugstore.
Thank you. I have another question that says, my main impairment is freezing of the words that are going to come out of my mouth. It's not stuttering, it's not soft. It just happens at certain times of the day with no pattern. I simply cannot speak or speech is delayed substantially. LSVT doesn't help me with this specific situation. Do you have other advice, please?
Yeah, this again, this is a tough one without knowing you and working with you. Um, I would say some strategies that you could work on potentially with a speech therapist, I know, is working on identifying, the times of the day when you are freezing, seeing if, and maybe you have done this already, you can let us know, but seeing if it's around the same time as maybe a medication off time for you or related to anything else that maybe you weren't thinking of before, like it's just before lunch or like maybe you're thirsty or you're hungry or there's something else going on in the body that might be causing that. Um, but in terms of like an exact strategy, it is a little bit hard to give. I don't know, Allie, if you have maybe a more tangible advice.
Yeah, I mean, I think that that's a fabulous recommendation, especially if someone gets tired, then communication can get worse, at the end of the day or after a really busy couple of hours. If you are feeling like, I know what I want to say, I can't get it out, or I'm feeling that like halting in my speech, it might be helpful to look into alternative communication tools. So maybe some sort of communication device, an app, or using your cell phone if that's functional for you, just to see if maybe there's anything that you can use outside of verbal communication when those moments strike.
Thank you. And I actually do want to shout out to Allie, who did a wonderful presentation about AAC at APDA's virtual Parkinson's conference earlier in February 2025. So you can see that presentation about AAC on the APDA YouTube channel.
Yes. Oh,
And
I forgot about that was last year. Yeah.
yeah. I have one question that's come in from David. We've talked about swallowing quite a bit, and he's asked, how important is it to eat when you're on your on time for medication?
Mm. Yeah, I mean, David, it's most important to eat when you're hungry. We hope that it falls in alignment with a good medication time for you. But I would say, life isn't perfect, and you should probably know what eating is like on your on and off time. Now, you don't have to go out of your way to eat on and off time, but if it happens to happen a mealtime during your off time, that's a great time to keep track of, we talked about a swallow tracker or a journal. Keep track of your symptoms, like what happened during the off time, right? These are things that you can take to a speech therapist who can help you choose safely, have a safe meal, whether it's your on time or your off time.
Mhm.
Ideal would be your on time, right? But things happen. You might be traveling, going to a restaurant, things like that, where you can't always eat on your off time. So I think it's always a good idea to know the spectrum of your eating and how that may or may not change. I think too, Anushka, I saw a question about who makes the swallow tracker. So
Mhm.
your speech therapist can give you, if you ask them to create something for you, or you can simply just take a notebook, write down the date, write down breakfast, what happened, lunch, what happened, snack, what happened, dinner, what happened, or if nothing happened, that's great. You don't have to write anything down, but it can be as simple as just a notebook, the date, the meals you ate, and any signs that you experienced.
Absolutely. I think that question was from Lori, who had asked, who develops that baseline and that tracker? Is it the speech pathologist or the doctor? So say that, someone wanted to start tracking all of this in their notebook. Would they take it into their next doctor's appointment? Would they ask for a referral to speech therapy?
Yes, you hit all
Mhm.
of it, Anushka. All of what you said. That's it.
Great.
Yep, bring it to your doctor, ask for a speech therapy referral, and you have your symptom tracker right there to let them know the reasons why, which is going to be great. And they can make a referral for a speech therapist for you.
Wonderful. And I think that is all the time that we have today. So I just want to thank you on behalf of APDA, on behalf of our audience. Thank you so much for sharing your expertise with us. We are very excited to welcome Lingraphica speech therapists back in February. We have Dr. Treasure Williams Wood and Olivia Bayer who are going to talk about even more in-depth techniques and strategies for voice and swallowing on February 11th. And we have another couple of speech therapists, Corinne Casey and Anna Reeve, who are going to talk about staying connected and overcoming communication barriers on Wednesday, March 4th. So Thank you so much to our presenters. Thank you so much to our audience. We're looking forward to seeing you at a future APDA Thriving Through Speech Therapy series episode. Thanks, everyone. Have a wonderful rest of your day.
Thank you so much.
Bye.
Chambers, the President and CEO of the American Parkinson Disease Association. Each month across the country, APDA is providing support groups, exercise classes, and educational programs like this one to support the Parkinson's disease community. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. If you enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Your gift can help APDA support people living with PD through local programs, reliable resources, and groundbreaking research designed to find treatments and ultimately the cure for Parkinson's disease. Please donate today at apdaparkinson.org/donate. And thank you so much for your support.